Thank you very much today. We're proud and honored to be here on the territories of the Lekwungen-speaking people, and I'm Adrian Dix, BC Minister of Health. Beside me is Dr. Bonnie Henry, the Provincial Health Officer for British Columbia. And as you know, we committed to provide information as it became available to members of the public about the novel coronavirus, and we've consistently done this. Today we're providing another update, and I'll be introducing Dr. Henry in a moment. Tomorrow at 9:30 we'll be providing, as we are weekly, information on the number of people who are tested in British Columbia through the BC CDC, the number of tests that are conducted at the BC CDC that will be released tomorrow at 9:30. And with that, I want to introduce Dr. Henry.
Thank you very much, and welcome this afternoon. So there's a couple of updates we have this afternoon, first of which is that we have identified 2 new presumptive positive cases. Both of them are related to the case we announced on earlier this week. I'm not sure what day it is. From Tuesday this week. And further investigation within that household has identified that 2 people who are both visitors from Hubei province were in contact with the individual who was a case that we announced on Tuesday. So these 2 visitors are a man and a woman in their 30s, and they have had illnesses that are compatible with the novel coronavirus, and in the course of the investigation they have both tested positive. And we are, having done the epidemiology and the investigation within that household, one of these individuals is very likely, and we're quite confident, is the source for the case that we announced on Tuesday here in British Columbia. So just to clarify a few of the issues around the household, there was some concern expressed to me that perhaps there was asymptomatic transmission. That is not the case. The individual who was the source for our second case did have a compatible illness, but it was a relatively mild illness. And that is something that we're recognizing more and more from the cases that have been recognized in China, that young people, particularly young healthy people, can have very mild illnesses that may appear like a cold. This person did not seek medical attention for his illness, and is likely the source of the illness in the woman that we identified earlier this week. So Vancouver Coastal Health continues to monitor and closely provide assistance to these people. They all remain in the household in the Vancouver Coastal Health region, and they're all in isolation. So a number of close contacts as well as the 3 cases. So this is the major update we have today. The other piece that is somewhat related to this is the changing recommendations that I spoke to earlier this week around people who have come from Hubei province. And we know that the number of people who are leaving Hubei province now is now quite small, and in the order of 50 to 60 people a day across the country. However, we also know that there are people who are in BC here now, who have been in Hubei province, and as this case demonstrates, may have had a mild illness compatible with this, and may have issues with others in their close contact who may be incubating this disease. So for that reason, we're reaffirming again the importance of monitoring for symptoms, and for people who have been in Hubei within 14 days, to make sure that they self-isolate and stay away from others. So what we're asking people to do is to stay away from work and to keep children home from school for the 14-day incubation period for those who have been in Hubei province or have had close contact, so living in a household with somebody from Hubei province. We're also asking them to contact us in public health, and you can do that by calling your local public health office or by calling 811, and we'll connect you with your local public health office so we can support you in how to do that and how to monitor for symptoms, the types of things that you might have questions about how to do this effectively. We've also notified our partners, for example, in education, about these measures and the importance of these measures. For anybody who's come from other areas of China, we continue to tell them how important it is to monitor carefully for symptoms. And if you have any symptoms, even of mild illness like a cold symptoms, to please connect with us, and then we can work with you to determine whether assessment and testing is needed and how to do that safely and appropriately in our province. So that's the really important change that we've made now. I think it bears repeating that this is a really important measure for us to connect with people in the community, to provide them the support and the advice we need. This virus, as we're seeing, doesn't respect the political borders that we've put in place. It doesn't respect it moves around the world, transmitted through the air. So we need to all be cognizant of the fact that we're vulnerable together as a global community to this virus. It's a time when we need to work together, we need to support each other. And we have been hearing some very disturbing references to China and Chinese people, and the fact that Chinese communities are feeling at risk here. And this is a time where we need to work together and support each other. These viruses know no boundaries, and it is something that we all need to do collectively to support people. If we start ostracizing people because they're sick, that makes it much more difficult for us to do our job in public health, to identify people and to be able to support and monitor them and safely care for them when they have this illness. Other than that, we'll be happy to take questions, or I'll turn it back to the Minister.
Yeah.
Okay, well, take
Just to say a few things in conclusion. I think that, as Dr. Henry has said, these are our third and fourth cases. There are that everyone is self-isolating. That we're talking about effectively 2 homes and 4 cases. Tomorrow we're going to have an update on the number of people we're testing, but you can understand that's a significant number of people. And just to reiterate the things that Dr. Henry is saying that we said consistently from the beginning, people can take steps to support the situation. That involves basic things such as cleaning hands and coughing or sneezing into your elbow, or in disposing of Kleenex, the kind of basic things. And if you're sick, stay home from work. If you're sick, stay home from school. That's not just related to this, but would be related to influenza or to anything else. I want to say finally this, that I think that we can be very proud in the Canadian healthcare system. And I include in this the discussion and what happened here at the time of SARS in British Columbia under the previous government, but it was our public healthcare system responding. And I'm very proud of the way we responded then, and I'm very proud of the way we responded now. Public healthcare and the way that it works together in British Columbia is a huge advantage in dealing with issues such as this. And tolerance is not just something that's important to Canadians, but it's important. It is, in fact, our strength in responding to this. It makes our public healthcare system and our society more able to respond to these conditions when people feel, because we want people to feel that they should report when they're sick. We want people to be confident that their privacy will be protected. We want people to work and support one another. This is our strength. It's the reason that we can respond well to circumstances such as this, circumstances that feel sometimes beyond our control. So this is our strength. It's not just the tolerance of Canadian society and something to be celebrated in the abstract. It's a real strength for our public healthcare system. As you know as well, in the federal government, in addition to updating it and responding on the question of people coming from Hubei province and the need and the encouragement to self-isolate, the federal government has also done, I think, extraordinary work in bringing Canadians back from Hubei province, bringing Canadians back from Wuhan. As you know, the first plane is in the air now, that it'll be landing for refueling in Vancouver, and then it's going on to Trenton. And I think as Canadians, we are obviously very supportive of this action and very hopeful and confident that it'll all go well on the flight and the trip, and we're very supportive of this action. So thank you very much, and Dr. Henry and I are able to take questions.
Okay, we'll start in the room. Richard, go ahead.
Dr. Henry, how do you ensure that those in isolation remain in isolation at home?
I mean, that's the work of public health. We work on this all the time. There's a number of different, what we call reportable communicable diseases that require people to take certain actions. So we follow up with people. One, we have a whole list of things that what we mean by isolation. Doesn't mean I can, go to my backyard for 10 minutes. Probably, right? But it does mean if you stay in a room by yourself, make sure that you're not sharing things like utensils where you can swap droplets and things like that. So we support people in being able to do that by providing them masks if need be, and we have daily ongoing contact with them. Sometimes that contact will be in person, and sometimes it'll be on the phone, but that's what public health does to try and support people. And this is something that I've found particularly during the SARS outbreak, and again, with the work that we do in public health, that if you ask people what you want them to do, you provide them with the supports to do that almost everybody does what you need them to do. Nobody wants to be transmitting infection to others, and it's part of our job to make sure that they are able to survive these types of conditions and to do it with our support.
And I'm sure others listening were able to track a little bit better what you were explaining at the beginning, but I'm trying to understand the relationship. So there's now 4 cases in British Columbia.
That's correct.
3 of them are linked. The 2 new ones today linked to the other one this week, and they're family members or they're living in the same house? What's the relationship with the case earlier this week?
So the initial case earlier this week lives in the Vancouver Coastal Health Region. She had family visitors come from Wuhan province, and they are in the same household. So these 2 new cases today are amongst the family visitors that came from Wuhan province.
Still here in Coastal Health
They are
in
all
isolation.
still in isolation in the household. That's correct.
Thank you.
April?
In light of what we're seeing with the cruise ships in Hong Kong and Japan, for people here who have cruise travel booked over the next few months, is there any message or word of caution to them?
That's something that we've been following quite a lot, and certainly the federal government has been too. These are the challenges right now when we don't know how we'll be able to potentially contain this. So I do think people need to be cautious about where their cruises might be going and the potential for this type of situation to arise. And I would refer people to the Government of Canada travel website where there's more specific information on that.
Cormac?
Knowledge regarding the cruise near Japan, if any of them are from BC or the island?
We don't know where the Canadians are from. We do know that there's over 200 and some Canadians on that one particular cruise ship, and we have heard that 2 of them have tested positive for this disease and are in hospital in Japan, as far as we're aware, and that they're receiving consular services. We don't have any information on where in Canada they're from.
Okay, I think we'll take a call from Vancouver, and we have Hayden Fanshawe from BCIT News. Go ahead. No? Okay. No? Okay. Any other questions in the room?
I get to stand up here.
You guys stand up here. It's good.
April, go ahead.
That's better.
Sorry, just as a follow-up to the cruise question, when you say people should be cautious, especially depending on the where their cruise is traveling, do you mean cautious as in when you board and taking health precautions while you're on your cruise, or be cautious as in consider canceling that?
I would consider, if I was going to the Government of Canada, advice right now, and the global advice right now is to avoid China travel to China, and sorry, the advice right now is to avoid unnecessary travel to China. So if you had a cruise that was stopping in areas in China, then I would, and I expect and I understand that many of the travel agencies are canceling those cruises as well.